Good. My name is Danny. I'm going to be your nurse practitioner student today. So nice to meet you. How would you like to be addressed today?
Tim.
Tim? Okay, Tim. So why don't you tell me what brings you in today, Tim?
Well, I've just been kind of, seems like I'm going to the bathroom all the time.
All the time, okay. Can you tell me, like, when about did that start?
It's been going on for almost 2 weeks.
2 weeks, okay. And did you notice anything around the time it started? Anything that triggered it?
No, I've thought about that. I can't figure out what caused it.
Okay. And when you say all the time, can you tell me a little more about that?
Yeah, I have to sit on the toilet, every 3 or 4 hours.
3 or 4 hours. And tell me a little more. Is it loose when you're going to the bathroom? Loose stool? Or?
Oh, yeah. I mean, now it's really loose, like
Okay.
watery.
Is that different than when it first started 2 weeks
Yeah.
ago? Okay. So it's gotten more loose as time has gone by.
Yeah.
Okay. Have you noticed that anything has made it worse? Yeah, what kinds of things have made it worse for you?
Well, if I eat solid food, then it's worse.
Okay. Is it worse for you at any time of the day or at night? No.
No, it's just like 24 hours a day.
24 hours. Has anything made it better for you?
Well, I'm trying not, I'm not eating as much, and it's a little better if I just, have liquid.
Okay. Have you had any other symptoms like fever or chills or?
I haven't felt like I have a fever.
Okay.
No chills.
Okay. Do you notice any pain associated with it? Yeah, what kind of pain?
I get crampy.
Crampy pain right before you go to the bathroom? Okay. Does it feel better after you go to the bathroom?
Yeah.
If you had to rate that pain on a scale, 0's no pain at all, and 10's the worst pain you can imagine, where would you put that on the scale?
I don't know, it's pretty uncomfortable. 3 or 4.
What do you think the problem might be?
Well, I did, I told you I'd been thinking about it, and what I forgot to mention that there's some people in my church group that I've heard have something similar going on. So I don't know if I caught something, one of the meetings.
How's it affected your daily life?
Oh, I feel good.
Yeah.
I don't feel like going to class. I mean, I can't go to the bathroom and do a lecture.
Yeah.
Well, I can, and I have, but yeah, we need to figure out what's going on.
Okay. So it sounds to me like you started having more bowel movements than you normally do about 2 weeks ago, and over that time it's gotten looser. You have some cramping before you go to the bathroom. It feels a little better after you go, and you about every 3 to 4 hours. Pain's about a 3 or 4 out of 10. Not eating is mostly the only thing that's made it better. You've been on like a liquid diet since then.
Well, no, I still, but I'm not eating anywhere near as much solid food.
Solid food has made it worse for you. Is there anything else I'm missing? Okay. So I'm going to ask you some questions about your past medical history just to get a little better understanding of your overall medical health, okay? As a child, did you have any major health concerns or surgeries? Any issue with your appendix or any surgery on your abdomen at all?
No.
No.
Nothing unusual.
Okay. Any issues with bowel movements or Any autoimmune issues? No. Okay. All right. As an adult, have you had any health concerns?
Well, I've got a thyroid thing.
Um, is your thyroid overactive or underactive?
It's hypothyroidism.
Hypothyroidism? Okay. Do you take medication for that?
Yeah.
Okay. Do you know what kind of medication it is?
Levothyroxine.
Okay. And do you know what your dose is?
No. Thought I was doing well.
Yeah, I understand. It can be hard.
Yeah.
Do you remember when the last time you came in to have your thyroid checked?
Yeah, just last year.
Last year. And do you remember if the levels were?
Yeah, the doctor was fine with the levothyroxine.
Okay. Alrighty. Any other medical issues in the past? Any urinary tract infections? No? Okay. Any history of hepatitis or liver issues?
No.
Any issue with something called diverticulitis or any bowel issues before this?
No.
Okay. Do you have any allergies to drugs or food?
Yeah, both.
Okay.
I can't take sulfa stuff.
Okay.
And I can't eat strawberries.
Okay. Strawberries. What happens with sulfa?
Yeah.
A rash. Okay. And what happens with strawberries?
Oh, they make my mouth itchy.
Itchy. Okay. So you mentioned the levothyroxine. Do you take any other medication?
That's the only prescription thing.
Okay. Do you take any drugs that you would buy at the grocery store?
I take a multivitamin.
Any supplements or anything like that? Okay. And do you take the multivitamin every day? Okay. Do you take any like ibuprofen or Tylenol on a regular basis? Okay. Immunizations, did you have a flu shot this year?
Last fall.
Last fall? Okay. And do you remember if you've had immunizations against hepatitis A or B?
I don't recall that, but I know my doctor said everything was up to date.
Okay.
I don't remember hepatitis.
I'm going to ask you a little bit about your family's health history, okay? Probably some specific questions. Does your family have any history of colorectal cancer or bowel cancer of any kind? Some people call it Lynch syndrome. No? Okay. Any history of like gallstones or history of gallbladder issues? Okay. Any issues with kidneys? Polycystic kidney disease? Any history of autoimmune disease like diabetes or rheumatoid arthritis? Yeah, diabetes.
Yeah, mom's diabetic, and dad, he said that the doctor told him he was heading that direction.
Okay.
Apparently not yet. I'm not worried about it.
How old is your mom?
Mom's 49.
And does she have any other health issues?
Yeah, her blood pressure.
And how old is your dad? Does he have any other health concerns?
Cholesterol.
Cholesterol. Do you have any siblings?
I do.
3. Okay. Brothers, sisters?
Got 2 sisters.
And do they have any health issues?
No.
Okay. I'm just gonna now ask you some questions about your life and just get to know you a little better. So let's talk about your diet since you're having some issues with your stomach. Just tell me a little bit about maybe not right now because you're having some problems, but on your average day, what do you eat for your breakfast?
For breakfast, sometimes I'll have oatmeal, sometimes in the
And lunch?
Lunch, I'll usually eat in the cafeteria also. At the
Salad bar.
yeah. And, sometimes I'll have something else like a hot dog or so. And try to eat the vegetables or something.
Yeah. How many servings of fruits and vegetables do you think you get a day?
I don't know. I never keep track of servings. I
Okay.
just try to get some every day.
Couple times a day.
Yeah.
Okay. And do you eat meat?
I do.
Okay.
Yeah.
How many times a
Not
day
very much.
do you think you eat
Well,
meat?
there are a lot of days I don't eat anything.
Okay.
But it's usually, if I'm in the mood for a hamburger or hot dog, or I'll have something with chicken in it. But I don't eat a lot of meat.
Do you eat fiber in your diet at all? Rough greens?
I happen to like broccoli.
Broccoli? Okay. Do you have dairy in your diet at all, like cheeses?
Well, yeah,
milk?
I'll eat yogurt and like cheese.
And then have you noticed any changes since you've started feeling, other than not eating as many solid foods?
Yeah, I
Have you
just
recently changed your diet at all?
Oh, well, yeah, over the last 2 weeks.
2 weeks. Okay. And any food intolerances that you've noticed?
No, just the strawberry.
Just the strawberry. Do you drink any sugary drinks?
No.
No?
I'm not. Every once in a while, I'll have a Coke, but
Yeah.
not very often.
And do you drink water every day?
Yeah.
Yeah. How many ounces of water would you say you drink? Or glasses? How about glasses?
I don't know. You know, 4 or 5.
4 or 5?
Maybe.
Okay.
I don't really keep track if I'm thirsty.
I know it's hard to keep track of that kind of stuff.
Yeah.
Okay. What about sleep? How many hours of sleep a night would you say you get?
Not enough, man.
Yeah.
Because of this thing. But normally I sleep 7 or 8 hours.
7 to 8 hours. Okay. All right. Do you smoke tobacco at all? No. Okay. Have you ever?
No.
Okay. And do you drink alcohol at all?
A little bit.
A little bit. Okay. Once a week, couple times a week.
Oh, on weekends, then sometimes I'll have a glass of wine or two.
And do you use recreational drugs at all? Okay. Have you ever in the past? Have you ever been in the military?
No.
No. Okay. And any concerns about your health insurance or paying for this visit
No, I'm
today?
still on my mom's and dad's.
Okay. Do you live at home right now, or are you?
No.
Yeah. And I heard you mentioned you're in school right now. Do you work as well?
Yeah.
Okay. What do you do for work?
For birth.
Do you have any hobbies?
Well, not really. I mean, when I get a chance, I like to get out of town and hike.
Yeah.
I like to walk.
How often do you hike?
Not as often as I'd like, since I'm in school.
Yeah.
But yeah, I'll head out when I get the chance. A couple times a month.
Yeah.
And then, I hike around here, down Seward Park in South Seattle. Sometimes I drive down there and hike around.
Yeah. Do you do any other physical activity?
I have a bicycle. I ride that. Not a lot, but get around on my bicycle.
And have you done any recent travel?
No.
Okay. Now, I have a set of questions we ask all of our patients. Are you sexually active right now? Okay. Do you have a current sexual partner?
Yeah.
Okay. Have you had sexual partners in the past?
Yeah.
Okay. And do you use any sort of prophylaxis for sexual activity? Condoms? Do you use condoms consistently, occasionally? Yes.
Yeah.
All the time?
Yeah, I know all about that. I'm really, really careful.
Any history of feeling unsafe with a partner or any history of um, uh, physical or sexual abuse?
No.
Right. I'm going to go through what's called a review of systems now, where I just ask you yes or no to any symptoms that you're feeling, and we'll just go through the list really quickly. If there's anything that needs clarification, we can go over it. Okay. So first, have you any fever or chills?
No.
Okay. Any weakness or fatigue?
Yeah.
Yeah. Any decrease in appetite?
Well, yeah, I don't feel like eating.
Any sweating at night? Any uh, gain or loss of weight? Yeah. How much would you say?
I just weighed myself this morning and I'm down 5 pounds from my normal.
Any itching or rash? Any breaks in your skin or bleeding of your skin?
No.
Any bruising? Any changes in the color of your skin? Any changes in the hair or nails? Any bleeding or changes in your gums?
No.
Any toothache or pain in your teeth? Any changes in taste? Any sore throat or hoarseness? Any difficulty swallowing? Any pain or swelling in your neck? Any development of cough or productive cough? Any wheezing or pain when you breathe?
No.
Any shortness of breath? Do you have any history of asthma? Any exposure to tuberculosis?
No.
Any pain in your chest? Any feeling like your heart's racing or like your heart skipped a beat? Any waking up from the night feeling like you're gasping for breath? Have you had any history of high blood pressure? Any difficulty breathing when you lie flat? Any swelling in your arms or your legs? Any dizziness, lightheadedness at all? And any pain or swelling in your lower extremities? We talked about change in appetite. Have you had any heartburn or?
Not recently.
But in the past?
Oh, yeah, it's never been a problem, but yeah, if I eat pizza or jalapenos, I pay for it.
Okay. Any nausea or vomiting?
Nausea, yeah.
Nausea.
Yeah, I haven't thrown up. I feel nauseous.
Okay. Any like excess belching or gas at all? Have you ever been told or noticed that your eyes are yellow or that your skin is yellow? Any constipation? Definitely not. Okay. Have you noticed your feels distended or bloated?
Well, the crampy feels kind of weird, but it hasn't really, no, it hasn't really felt bloated. No.
Have you noticed any blood in your stool at all? Any like dark tarriness to your stool? Oh, okay. Any pain when you pee? Any increased need to pee? Feeling like you need to go? Okay. Um, all right. Well, I think we'll do the assessment now, okay? So, I'm just going to start by listening to your lungs here really quick, okay? So, I'll just have you take a nice big deep breath in through your mouth here for me. I'm actually just going to untie this here. And I'm just going to have you just pull this down for me.
Okay.
So big deep breath in through your mouth. And I'll have you lift your arm up for me here. Very good. Okay, you can rest your arm now. Come around behind you and listen to your here. Again, you can just take nice, deep, slow breaths in through your mouth. And then every time I place my stethoscope, great. Will sound normal here. I'm going to listen to your heart so you can just breathe normal now, okay? Have you lean forward slightly for me? And I'm just going to press gently on your chest here. You just let me know if anything's painful for you. I'm going to have you lay back and I'm going to just assess your abdomen here, okay? A little bit for you. There you go. Okay for you?
Yeah.
Again, I'm just going to be listening, okay? Let me know if anything hurts you or feels tender, alright? really know, okay? Again, if anything hurts or feels tender, you just let me know, okay? Pressing on your abdomen now a little bit, okay? And I just want you to let me know anything feels painful or tender. A little bit deeper now. I'm going to do a technique that feels for your liver. So I'm going to have you take a nice big deep breath in for me, okay? And then breathe out, okay? Deep breath in. Breathe out. And I'm just going to reach across here. And I'm going to place my hand over here. This feels for your spleen, so go ahead and do the same. Take a nice big deep breath in. Breathe out. Good. All right. You can sit up now for me, okay? At this point, I would perform the rectal exam. So you can place your gown back on.
Okay.
And I would have the patient raise the table and stand and bend over the table, don gloves, explain to the patient why we'd be doing the rectal exam to check for any masses or lesions, and also to, depending on the need, check the prostate as well. And after checking the perirectal area for any lesions or hemorrhoids, I would lubricate my finger and ask the patient to bear down. Placing my finger in the rectum, I would feel for the median sulcus and the lobes of the prostate, and then rotate my finger, searching for any lesions. I can also have the patient bear down to move any masses into the area. And then after I'm completed, I can remove my finger and test for any occult stool, if there's any stool on the glove, and then help the patient come back into a seated position and give them a tissue to help clean up. So, do you have any questions for me at this point? Okay. We'll continue to work on helping you feel better, okay?
Okay, you all done?
Yeah.
All right. So go ahead and turn off your, you got 40.